Hi, my name's Nolan. I was in a group with Sarah and Austin. I apologize for the confusion with the two topics here that were the same, but I guess we'll all be experts by the end of this. So ours was Osteogenesis Imperfecta. And so what is it? It's a genetic disease resulting in abnormal bone formation, and this causes the bones to be weak or brittle. As you can see, it's also called brittle bone disease. And so to break it down, like the name, osteogenesis is bone formation, and then imperfect is imperfect, so imperfect bone formation. And so for the diagnosis for this, it's either a physical exam by a doctor, and then they'll also do collagen testing. Family history plays a role, and then x-rays can reveal the deformed or damaged bones. So osteogenesis imperfecta is caused by a genetic gene mutation from these two genes here. These genes are responsible for about 90% of the cases, and these genes are important because they play a role in protein formation for connective tissues, which bones are a connective tissue, and that's how they get affected by the mutation with these genes. So there are actually 8 types, but there's 4 primary ones that I'll talk about here. So first one is type 1. It's the least severe and most common. And this would feature, fractures during childhood and hearing loss because of the small bones in your ear. 3 is quite severe as well. Deals with the curved spine, poor muscle development. 4 can range from mild to severe, but type 2 happens to be the most severe and life-threatening. It's the underdeveloped bones at birth and also soft skull bones. So with type 2, it usually results with death at birth. So for symptoms, includes weak muscles, malformed bones, loose joints, blue or purple sclera. So the sclera is the white of the eye. And the reason it takes on like a blue tint is because it's thinner than usual because of it's like sorry, I don't blank here. It's where the collagen, it's a little thinner there, and the protein's in the eye, so that's why it's kind of bluer. Problems breathing, brittle teeth, triangular face, bowed legs, as you can see in the picture there, and curvature of the spine. So for treatment, there is no cure for this, but there is lots of things we can do to keep you healthy and try to prevent further breaks. Surgery is an option, but that kind of depends on the severity of it. And so for the surgery, what they do is they'll put rods inside the bones to help strengthen them and give them more support. Physical therapy to strengthen the muscles around the bones, and also to help you just kind of prevent and learn what you can do to avoid putting yourself in situations where you could have fractures. A healthy diet with high calcium, and then just exercise, because with bones, the more you use them and the stress you put on them, it strengthens them, but that's kind of the trade-off with this. You don't want to put too much stress to the point where you break them. So you got to kind of find a healthy balance with that. So for prognosis, it varies greatly with each type. Children born with type 1 will live normal, healthy lives in adulthood with occasional fractures and whatnot. Less severe symptoms won't affect the life expectancy, but most severe cases will result in death at birth or shortly after. And then a lot of osteogenesis imperfecta deaths are because of respiratory failure, and that has to do with the collagen formation, and it affects the lung tissue, which is responsible for those genes I was talking about earlier. So for follow-up, you should definitely continue the physical therapy to make sure you're getting stronger and healthier. Checkups are important just to make sure everything's okay. Caution is also very important. You just got to make sure you're not putting yourself in situations where you could possibly break bones. You just got to look out for your surroundings. And then with, if there are fractures, which are likely to happen, crutches or wheelchairs just to help make sure everything heals properly, not put too much pressure, make sure those bones heal right. And so life with this, you just got to look out for your own safety, be vigilant, keep yourself in the best position to avoid fractures. Make your diet a priority so that way you can strengthen those bones. And then also you got to listen to your body. So if you have pain without a familiar cause or not sure or track it down how it happened, it could be a fracture, so it's important to go see a doctor and get that checked up to make sure everything's okay and those bones can heal properly. And these are my sources.
6 want to ask a question? Did someone think of a question during the presentation? Do you have a question, Faith?
What's the longest that someone has lived with type 2? Like the one where the bones break up, or do you know?
I don't know the answer to that one.